Welcome to this episode of our series of lectures on chronic joint pain. And today I feel especially glad to have you because I wish to talk about regenerative therapy, because you might have heard me many times talking about regenerative therapy as the best treatment for chronic joint pain. Yes, regenerative therapy is also known as healing treatment. Just as might have made you to understand that joint pain is as a result of damage or wound inside the joint. Therefore, to stop the joint pain, it needs to heal the wound. Okay? So, it is that wound or damage that is called degeneration. Therefore, the root cause of every chronic joint pain is degeneration. And let me demonstrate what degeneration is using this knee, for instance. Okay, so you can see the knee with smooth structures. The intra-articular cartilage is very smooth. The ligaments, the menisci, every tissue in this joint is very smooth. At the time arthritis starts, it can start at any point. Like here, it started at this cartilage, and you can see wear and tear at this cartilage. The rough part of that cartilage, that is the wear and tear or the degeneration. Unfortunately, it does not stay at one point. It begins to spread out, affecting the ligaments and every other tissues of the joint, causing the pain that does not go even when you take painkillers and all that, because the root cause is this degeneration. Okay, so what is happening in the knee causing pain, just as I demonstrated, is the cause of the pain in any part of the joint, any joint in the body. It can be in the neck, the lower back, the elbow, the shoulder, the wrist. Any joint in the body that is suffering chronic pain is because of degeneration of the tissues of that joint. And what is chronic pain? Chronic pain is any pain that has lasted for more than 3 months, whether it's persistent or intermittent. As long as it's over 3 months, you have been experiencing such a pain, you are having chronic pain. So if it's in the joint, it is known as chronic joint pain. Okay, so degeneration is the root cause of such a problem. Therefore, to heal that degeneration, you need regenerative therapy or regenerative treatment or healing treatment. And these are the modules of treatments we use to heal the joint. This is platelet-rich plasma, which makes use of the platelet cell of your own blood. If you are the one suffering the pain, we'll take your blood to produce this platelet-rich plasma and inject it inside the joint, and it will heal the joint. This is cold laser, using the laser machine to produce cold laser light, as opposed to hot laser, which can damage tissue. This is cold laser that heals the tissue. Okay, so this is ozone machine, which converts medical oxygen into medical ozone. So you have a mixture of 90% oxygen and 5% ozone. We're using the process of prolozone, which is also a treatment that regenerates or heals the joint. This is prolotherapy, also known as dextrose prolotherapy. There's also another one that is also known as human stem cell therapy. So these are treatment methods that can be used to heal the joint. If you are listening very well, you realize I did not mention any drug. There's no medication that can heal the joint. These are the treatments that can heal the joint. Okay, so let us take a bit time, small seconds, to understand what regeneration is all about. What is this all about? Because we have mentioned this several times. Now, let me use this animal known as salamander to demonstrate what regeneration is all about. Salamander is a reptile that has high capacity of regeneration. Okay, so because if it loses any part of the body, like the limb, imagine I cut up this limb. Yes, it will bleed, but after some seconds, minutes, the bleeding will stop. When that bleeding stops, the process of healing has started, or the process of regeneration has started. Okay, so if you look into that cut off limb, you will see plenty avalanche of cells at the end of that cut off limb, trying to regenerate all the tissues of that joint, the bone, the muscle, the blood vessels, the ligaments, the nerves. everything will be restored back to normal, that in 90 days, you will not know that this salamander had lost the limb. Everything will be restored back to normal. So, in essence, regeneration is a process of restoring back the worn-off part of the body, the wounded part of the body, the damaged part of the body. So, since it's wound or damage in the joint that causes chronic pain, that wounded part of the joint needs to be regenerated, just as we have seen the regeneration in salamander. When that joint is restored back to normal, naturally the pain would go. Okay, so yeah, that's salamander. But people would ask, do human beings regenerate? Yes, human beings do regenerate. We also undergo the process of regeneration depending on where the wound is. Like if I use the skin, this is a wound in the skin. Okay, if I can enlarge this wound in the skin so that you can see exactly what happens when we have wound. This is a cut in the skin. With time, you find out that all these cells around this place will begin to regenerate to fill up this wound. Okay, so the wound is filling up by the process of regeneration. Why it's called regeneration is that at the end of the day, everything will look normal, like where the person did not have wound at all. So that's why if I have a small cut in my hand, in a month, 2 or so, I might not even know that anything had happened there in the past. So that wound had healed through the process of what? Regeneration. The joint cannot heal on its own. The skin can heal on its own because it's what is called the labile tissue. It can heal on its own. But tissues like the joint cannot heal on its own like that. So it needs that regenerative treatment for it to achieve what the skin had achieved in this our demonstration. Okay, so that's what we do. Like here, I'm doing regenerative therapy for this patient. I'm doing the low back treatment because he complained of low back pain, which is going down his legs, entire leg, making it difficult for him to walk. So you can see where we marked using what is called the anatomical landmark to mark and locate the areas that are degenerated. We were able to see that because the person was able to do X-ray or MRI, which now showed us where the degeneration had occurred. So we use anatomical landmark to locate the place, and we are injecting the PRP in combination with ozone. So this is the PRP with the ozone treatment combination. They combine together synergistically to quicken the healing of the disc that is herniated, the ligaments, and every tissue around that joint, around that area. So it's very holistic and it can be wonderful. So with time, this person can begin to walk with less pain because the cause of the pain has been healed through the process of what? Regeneration. We'll also do that in the knee. We're also doing this for this patient in the knee because the patient presented with knee pain, chronic knee pain as a result of knee osteoarthritis. So we're injecting the PRP into her knee in combination with the prolozone. So what we achieved in the low back is also what's going to be achieved in the knee or any joint of the body at all, whatever joint it is. They all heal through the process of regeneration using this regenerative treatment. Okay? All right. So let's go a little bit scientifically to see how this regeneration actually occurs. So I'm using this knee that I treated. So I'm looking into the knee. I've injected my PRP into the knee. The wonderful thing about this treatment is the treatment is directly on the joint that is affected. So every dose of that PRP enters into the affected joint. Okay? Enters into the affected joint. So we are treating holistically. We are not just treating one part of the joint. The whole part of the joint is treated. That's what's called comprehensive treatment. So I've injected the platelet. The platelet is releasing the growth factors, which is going to the affected area. So this is the wounded part of the joint. It's circulating all over the joint, being attracted by the exposed collagen fibers in the affected area. Can be the ligament, can be the cartilages. The macrophages are released. The stem cells also are released. Everything working at that point. So the end result is that with time, that wounded part of the body will be restored back, just as we saw in salamander and in the skin. You understand? Every part, that part of the body will be restored back to the original tissue. That here, you might not see that anything had happened in this joint with time. How soon this happens depends at the stage at which the person comes. But at the end of the day, everything is restored back to normal. If you are looking at this, it will appear to you that this is a permanent cure. Yes, it's a permanent cure, but you don't achieve this level of permanent healing at every stage of the arthritis. It's usually better at stage 0, stage 1, and early stage 2. Stage 3 can achieve, but you might have to treat for a very long time to achieve the same result. That's why we encourage people to present early. You present early, the healing and the success rate is high. In fact, you stand up to 75% of permanent cure when you present early and not wait until the damage has become severe. And why people wait is because they continue to take some medications, some things advertised here and there, thinking that that will help. With this lecture, you are going to understand that there's nothing to take by mouth that can go to the joint to heal it permanently or heal it very well, apart from treating directly on the joint and inside the joint using this regenerative therapy we have mentioned. Okay, so I leave you with to realize that it's possible to live pain-free if you do the right thing and do it at the right time. The earlier, the better. That's how to achieve total cure of your chronic joint pain. Thank you for your attention. Wish to have you again in our subsequent lectures, because we would like to expose people to the right knowledge, because we found out that it is ignorance that makes people to suffer this problem for a long time. Because keep on taking the wrong thing, thinking you are doing the treatment. But with what I've said today, you have found out that the right treatment is regenerative therapy. See you again.